Hello and welcome. My name is Sean Williams, and I'm the Associate Professor of Political Science at Campbellsville University. And we are back one more time with the Senior Seminar Class of 2018 from the Political Science program, the Campbellsville Fighting Tigers. And we are very pleased that you have again chosen to join us as we are having yet another one of our conversations on important topics and issues of the day. Today I have three of the classmates who are members of the CU Political Science Senior Seminar class. First of all, I have Marshall Steele, who is, I think all three of these are returners, but Marshall. And then joining us from our DC office, we have Oksana Marquez and Eli Wood. How are y'all doing tonight?
Doing well.
If you've been watching any of our others, and if you've been watching our podcast in order, the last couple have been at 8 o'clock in the morning. This one is not, which means that hopefully everyone's going to be a little bit more awake. Our topic for discussion today is socialized medicine, and we're specifically trying to focus in on socialized medicine in developing countries. What does it look like? What are some of the best case scenarios in a couple of the countries that have well-developed socialized medicine? And then we're also going to talk maybe a little bit about the United States and what our healthcare system looks like, and whether or not Obamacare is as socialized as everyone says it is. So to kick everything off, just to kind of throw a question out there for people who are watching that might not know what socialized medicine is, what does the term mean?
So I kind of put two definitions when I'm defining this, because you think of, when you're not going to be policy specific yet, you think of the term socialized, and basically what that means is like a group instead of an individual. So when you think of socialized medicine, if you're just talking about it as a general topic, you're thinking of medical treatments, and especially when it comes to healthcare, socialized healthcare, is it's covered by more than the individual or paid for by more than the individual. So when we talk about socialized healthcare, of course, in political science, what we're referring to is most of the time is a government paying part, if not all, of healthcare costs.
When we talk about socialized medicine, the way you just described it, it's medicine that is collectively paid for collective benefit rather than individually paid for. Why don't we call it socialized education when we're talking about public education, or socialized transportation when we call it public transportation? Why don't we just call this public medicine?
Well, we have always had public education and transportation, so it's not as much of a foreign subject, but with medicine and healthcare, many places didn't have that. So it was a transition into socializing their healthcare system to make it whatever it is in the end that makes it socialized healthcare. So because it was a transition and wasn't something that it started out with, you had to socialize it in order for it to exist.
And further, I would say that we don't really deem, it's sort of a cultural issue, because we don't deem healthcare to be a necessity for a society the way that we do education and the police and fire departments. So if we change that social tendency, then we might be less interested in calling it socialized medicine. But for the time being, because it's so foreign to our cultural desires of necessity in a society, we just add that caveat in the front of it.
Right, which is crazy when you say that it's a necessity. I like how you use that word, because we sit there and say we have the right to life, liberty, and the pursuit of happiness. Well, if we're going to claim that we have a right to life, obviously you've got to think health, because health can define whether or not you live. And so if you're going to sit here and say everyone has a right to life, then don't we have a responsibility to protect that life? And sometimes that could be via healthcare. That brings up obviously a huge debate, even philosophically.
No, for some of the conversations we're having are based on theory. This is not one of them. But it was interesting. We've been rereading John Locke in one of our other courses. And Locke's actual quote was life, health, liberty, and possessions. We paraphrased that. We dropped the health part. But the original theoretical construct that this is based upon actually includes health. and makes that leap without you having to make it for them, which is kind of interesting. Now we're going to get into the weeds on this a little bit because we want to try to focus on, for people who don't really know how this works, we're going to focus on socialized medicine in a couple of specific countries. But in general, broadly speaking, what does it look like for socialized healthcare? Is it that everyone basically has a doctor and that's the only doctor that they can go to? Is it that nobody gets any healthcare at all? How does socialized healthcare work?
Essentially one of two ways, or in regards to how it's funded. Typically, either the government pays privately run doctors' offices and hospitals for the care, or in a larger sense, the government actually owns both the doctors and the hospitals, and they pay them like government employees instead of as privately contracted workers. That's all I've got.
Yeah, do both of those qualify? I mean, one of those sounds like basically our public education system as we understand it now. The other sounds a little bit like the public education system that conservatives want, a sort of a charter school system, or I guess in this case, a charter hospital system. What's so bad about either one of those?
Yeah, the difference is that in essence, socialized medicine or socialized healthcare would be the government owning all of the process, the doctors, the medicine itself, hospitals. So when we refer to socialized medicine, almost universally we're referring to a hybrid between private and public exchanges.
Right, and so that's why even if you say one country has socialized medicine, you're saying another one has socialized medicine, they may have two completely different levels of like control and two different systems, because from what I can find, there's not a country that's 100% socialized that it works, and there's not one that it's not at all part of the government. So just different levels.
Well, let's look at a couple of test cases, a couple of countries that do use socialized healthcare. So one example that that has been talked about, Rachel Wolf wrote about the Swedish healthcare system on our website, which is cu2018.weebly.com. And she presented this argument for what the Swedish system looks like and how does it work. How does Sweden do socialized healthcare, and how does it work in their country?
So Sweden kind of has, I don't want to compare it to the US, but simply for people to understand, you know, we have federal, we have state, and we have local government. And so Sweden kind of has those levels of government too, except they've got their central government, they've got county councils, and then they've got municipalities, which are like their little cities. And so each of these three levels of government plays a different role in their healthcare system. So you've got the central government, which establishes the principles, the guidelines, and sets the political agenda through they have something called the Ministry of Health and Social Affairs in Sweden, and that's the main body that does this, a part of their executive branch. And then they have the county level, which is responsible for providing health care and financing and delivering that. And they also provide dental care, interestingly enough, up to the age of 21, which I found very interesting, just as how important that is to them. And then you have the municipalities, which is a more local government, which is responsible for caring for the elderly and those with physical and psychological disabilities and disorders. And the way they have literally the way they finance it is very, like I was saying earlier, it's not 100% covered through government funding. It's 83% of health spending is publicly financed, and then the other percent can be through private means, or individuals do have to pay sometimes a little bit of money for their medical costs. And they also have like programs that have put time limits on their, like you can't, I think it says Sweden has a 90-day limit for how long you have to wait to be seen. Like you can contact a doctor and you have to be seen within 90 days. And that's to ensure, kind of make up for, because, you know, people are concerned when you hear about socialized medicine that then, well, people are going to die waiting because there's so many people that can get help. But they actually made up for that by putting a 90-day limit on that. And it's helped a lot. So Sweden now has one of the oldest populations in Europe. A fifth of their population is 65 or older. And they have one of the lowest infant mortality rates. Less than 3 out of every 1,000 babies dies when they're born, and less than 4 out of 100,000 women die while giving birth. So obviously they're a very successful case that we're looking at.
Do you have in front of you, out of curiosity, the numbers, comparable numbers for the United States for infant mortality or for birth of mothers and childbirth? If not, we'll check those out.
So I think the U.S. has 5.82 out of every 1,000. That's their child mortality rate, is 5.82 out of 1,000. As
out of 1,000 live births. As
compared to 3 out of 1,000.
And in 2016, it was actually 5.9.
And we're going in the wrong direction. Now, one of the concerns, bringing back this comparison between Sweden and the United States, one of the concerns that comes up frequently in the U.S. is, well, we have immigrants that come into our country at a higher rate than just about any other country in the world. One of the few countries that everyone wants to try to get into. They come into our country, they steal our social services. As a result, we have to pay higher taxes. Sweden also has historically had a high level of immigration proportional to their population. They tend to have a fairly large refugee population. How do they handle immigration? Have they erected some effective boundaries to keep immigrants from getting access to healthcare?
So like I was saying earlier, they're one of the most successful cases, and at the same time, they are actually one of the most generous countries towards immigrants and healthcare, because they allow undocumented people, like if they don't have any papers or anything, to walk into somewhere and get emergency health and dental insurance. Once again, I just think it's incredible that dental insurance is such like a priority there, because you think of the U.S. and you're like, okay, almost never do you consider like dental stuff an emergency, but and all documented.
There's a good Kentucky joke in there somewhere, but I don't know where it's at.
Oh gosh, but they also allow undocumented children under 18 treatment at no charge whatsoever, and they still have such a successful rate with their health care, and they're not going broke through their healthcare system. So I think they're doing something right, obviously.
Yeah, they definitely, the only thing that I would add to that is that they have one measure which just says that unless you can't find treatment, then those undocumented immigrants will receive it from the government, but they are encouraging those who come into the country to seek a private insurer or purchase insurance before they'll provide it. But ultimately, if it can't be deferred, then they are interested in that provision.
So it's not that they're immediately, if I understand what you're saying, Marshall, it's not that they're immediately ushered into the system as full citizens unless you're under 18, but rather that you're allowed to use it as a bit of a stopgap. Is that what you're saying?
Yeah, yeah.
Now I'm gonna make an argument, and sort of a tongue-in-cheek argument. I mentioned Campbellsville University is located in Kentucky, a kind of tongue-in-cheek argument aimed at Kentucky. But one of the arguments that we make in the United States when trying to compare socialized healthcare in other countries to the United States is, well, you know, Americans, we have different diets, we have different healthcare habits, we tend to have higher rates of obesity, higher rates of diabetes. That should not be a result of the healthcare system. I mean, it doesn't make any sense because I know I have to pay for my healthcare. I'm going to take less care of myself. Could you make the argument that the health benefits that you were talking about earlier, lower infant mortality rates, for example, longer life expectancy, that actually has nothing to do with socialized healthcare? That's really just a cultural difference. Their society's healthier than ours in general.
I think specifically with the infant mortality rate, I would at least say that healthcare plays a significant role in that, just because if you look in the US at how many are like teen pregnancies or just younger generations that maybe don't have the proper health care and that didn't have the money to go to the necessary like doctor's appointments. And so they didn't know that maybe they were doing something wrong, or that there was something that they could have improved on taking care of their baby that would have not caused either them to be sick when they were born or even to die in extreme cases.
The Organization for Economic Cooperation and Development actually produced a study that went into detail on about 34 countries, and most of those countries were similar to the U.S. in percentages and such. And the U.S. actually spends almost 3 times more per capita on health insurance and on healthcare needs than any other country. And yet we have an infant mortality rate that can be compared to that of third world countries, and we're still not healthier, but we spend more money on healthcare than anywhere else. So I do think that it's not only a lifestyle change or a lifestyle contribution like as obesity and such, but I do think that improvements have been made in Sweden that show more access to healthcare does lead to longer lifespans and less at-risk death.
Now, in addition to the discussion of the healthcare system in Sweden, we also had Jordan Duff on our website who talked a little bit about the healthcare system in Finland. Is the Finnish healthcare system essentially the same as the Swedish system? Are there fundamental differences? What's the Finnish system like?
Yeah, it's predominantly the same. Oversight is governed by the federal government, and then municipalities within Finland do the majority of the administration. There's a large public sector, that provides the majority of the coverage, but about 3 to 4% of it is still covered by private insurers. So it's still a dual market, but it's heavily in favor of the public system. And they, contrary to most statements about socialized medicine, nothing is free. Obviously, they still pay through general taxes, state subsidies into the system. And when they arrive at the doctor's office, they still generally have to pay a fee following any medical care, but it's incredibly low relative to costs that you'd see in the United States because their own tax dollars are funding the majority of it.
Is there any, for either Sweden or Finland, either one, Oksana, you'd mentioned that the healthcare system tends to be cheaper overall under socialized medicine. Is there any information about how, relative to the United States, what percentage of taxes either of these two countries have to pay, how much of their economy is controlled as a result of the control of the socialized system?
Yeah, in Finland in specific, or in particular, they spend about 9.1% of their GDP on healthcare, and the United States, most recently in 2016, spent 17.9% of its entire GDP on healthcare. So nearly half, just under half of that is spent in Finland.
Okay, but let's be fair with Sweden and Finland both. If you throw in Norway too, which is also socialized healthcare, these are two well-developed, but they're also two fairly socially uniform countries. They're relatively small countries, relatively low levels of economic inequality in those countries. Is there any reason for us to believe that we would be able to transfer the same approach to socialized healthcare to the United States and have it work as well in these more, these smaller, more efficient economies?
Right. I would say, to me, I'd say that's like the #1 concern for people saying like, okay, let's just take this healthcare system from this country that's not exactly like the United States and just implement it. And the reason it wouldn't work is because obviously the populations are not the same. We're a very diverse population. I mean, we have so many, like 362 million different people. So obviously, just, I'm not saying the population alone just makes us a different case, but it almost does because it's also a very diverse population with a diversity of issues too.
I think we
Yeah.
also
Go ahead.
I think we also have more interest groups who are opposed. We're more divided on where we stand. We have more money to go opposing this or supporting socialized medicine in America. And I think that plays a lot to it, and that it's not something that you can do overnight. And unfortunately, there's also not how to make your country depend on socialized medicine for dummies. Like nothing, no two countries are the same. And so there's not a manual for us to follow to say, well, these are the steps we do to make, 300 and however many million people have health care. It's just not that easy.
Yeah, and in doing some research, there are some very large countries that have at least a semi or a predominantly socialized system. Canada, Germany, Australia, but, and to reiterate what Oksana was saying, there are tremendous powers politically and economically that have stake in keeping the private sector flourishing. So long as that, and I don't mean to jump into this big money and bureaucracy stuff, but so long as those powers have that influence in Washington to keep the private sector strong and to thwart any efforts legally or economically for socialized medicine to go on, then I don't think we'll see it work as well as we do in other countries where most all interests are invested in the socialized medicine itself.
Right, we're a capitalist economy, like we thrive on competition. So you take that competition away, what's going to happen to all these people who are in the private sector, private medical sector, How's that going to look on the president that decides to do that so many people lost their jobs because they decided to switch to a whole nother healthcare system?
Yeah, or if the United States goes the route of socializing to the degree that they own doctors and hospitals, then it will look really bad that the government is seizing the entire American healthcare industry. So I think politically it just really doesn't play well here.
When you talk about this question of seizing control of the healthcare system, one fact that a lot of people point to is the relative size of current government spending. So in 2016, for example, the Trump proposed budget, it already had the United States government spending $1.1 trillion on healthcare. That's roughly 27% of our national budget, $1,106 billion. If the US government is already spending that amount of money, according to the nationalpriorities.org, the National Priorities Project, if they're already spending that amount of money on healthcare, is our healthcare system already somewhat socialized?
So America has a few aspects of our healthcare system that are socialized. We have we have some healthcare for people with disabilities, people at or below the poverty level, people who are unemployed, so like Medicaid, Medicare, and the VA. But it's not necessarily controlled by the government, and that is also not a large portion of America that are affected by these benefits. So I don't know if you could necessarily say that we're socialized.
No, certainly, if you were to talk about the successes and failures of the Obama administration, whether you're for it or against it, one of the marquee successes legislatively was Obama's success in passing the Affordable Care Act. Does the ACA move us closer to socialized medicine? Is it fundamentally designed in the same way that the Swedish system is or that the Norwegian system was?
So originally, the HR 3200 that the House passed, the original version that went to the Senate, was much more like Sweden and Finland and socialized healthcare almost completely. However, when it got to the Senate, a series of events happened that were extraordinary in that Senator Kennedy died, and then a Republican from Massachusetts took over his seat, Senator Brown. And so through that, and like the Republicans being able to filibuster and budget reconciliation, they actually, the Senate, watered down the original American Care Act, Obamacare, however you'd like to call it, into what we have now. But with Obamacare, that didn't demand that the government pay for it. It just demanded that everyone have it. So it was access, not paying for it. So I don't think you can necessarily say what we have now fits the definition of what socialized medicine is, because although it mandated access, it didn't mandate that we pay for it. It sort of, its intent was to expand accessibility.
So then ultimately the concern was over the lack of the American people to not have health care, as opposed to the desire of the American people to have health care. I mean, that sounds kind of odd.
I'm sorry.
Well, the way that you described it, it sounds as though the concerns with the ACA is that we're forced to have health insurance because the government isn't providing us with health insurance. So we're not really worried about it being socialized. I mean, that seems sort of...
I think the concern for many Americans was that this was a step towards socialized medicine. And at first, obviously it was, but that wasn't the end result. But this did force everyone to have health care, and it put penalties in place for people who didn't. It put a burden on small businesses. I mean, if you had 50 or more employees, you had to provide health care. And so that put a burden on people to get health care, and sort of the opposite of what it wanted to happen. It then caused premiums and insurance to skyrocket. And sort of the latter effects were that in some markets, insurance companies were pulling out, and it was sort of monopolizing it. But its intentional goal was for everyone to have health care. And that obviously had some adverse effects that maybe we weren't prepared for when it first happened, or maybe the first bill that they intended was prepared for this, but the end result did have unintended consequences, which resulted in somewhat higher health care and maybe lack of accessibility, and tax burdens on people who did not get health care when it was then mandated that we had to have it.
Yeah, I think of it sort of like the stock market, in that if there's a new economic venture on the table, but it's risky, and you present it the way that Obamacare was, or the ACA, then the private sector might dive on it, and they might fly away from it. And since there was only compulsory, the compulsory statement that you have to get insurance, but not as many compulsory indicators for private companies that would make it more appealing to them. That's sort of how it fell apart, is that there wasn't involvement the way, as enthusiastically, by the private sector as there should have been to make it really flourish correctly.
Yeah.
Sorry, go ahead.
I mean, really the success of, if you think Obamacare failed or if it succeeded, depends on how you define that. Like, it did bring access of healthcare to more Americans. I think 20 million more Americans gained healthcare coverage through the ACA, and it made many of them more financially secure, and that it protected them from catastrophic events. But the U.S. does still have some of the most expensive healthcare, and our healthcare system alone, as is everything in the United States, is very complex and confusing. And I mean, the average American, or I mean, even the better than average American, still can't comprehend that. You can't, with the ACA, it made it to where you couldn't always keep the doctor you wanted. And so that, like, you might have to change plans or change doctors. But it gave us a vision for what we can expect from healthcare and like what that baseline can be, I think.
And I think one of the biggest challenges, of course, in America, everything is going to be over politicized. But what it comes down to is that because we already had a private health insurance system, well, you're going to tell people then that already have health insurance and that are doing fine financially, hey, now your taxes are going to go up and you're going to be paying for somebody else's healthcare who doesn't have it, as opposed to this will be like, there's no benefit for those people, only loss because they're paying more in taxes. And so there's no incentive for the people who already had health insurance, the upper class or even middle class people. It's helping the lower class. And so in terms of public opinion, if like something like the Affordable Care Act, or even like you were talking about how there was even a more extreme measure, but because of politics, it couldn't pass. If there's any hopes of that, like obviously it'd have to be an all or nothing system. Like it's going to have to help everybody, or why would people who are fine and already have health insurance like want to give more money towards it?
Now, certainly one of Trump's priorities has been trying to find a way of repealing the Affordable Care Act. He's so far failed to do that. John McCain's infamous thumbs down vote. Have there been any successes from Donald Trump in rolling back some of the impact of the Affordable Care Act, or is it essentially the exact same that it was under Obama?
Yeah, they've done at least two big things. They passed the Tax Cut and Jobs Act, which the biggest component of that is it removed that individual mandate stating that you have to buy insurance or you'll be fined. I'd say that I don't know that that's all that they wanted to do in that bill. Obviously, they failed with the skinny repeal, but this was the biggest political move for them. The biggest political win is to go back to their base and say, now we're not, the government's not forcing you to purchase something anymore. And then again in 2017, they passed the American Health Care Act, which lowered some of the premiums for people our age, 20s to 30s. But it did, in that it also raised the income cap that you can have to receive tax credits or tax cuts from $50,000 all the way up to $115,000. So the Republican administration seems like they knew they couldn't dismantle the entire system all in one, and they knew that politically they couldn't do it either. So they're taking little bitty shots both to appease voter base and to appease some of the more higher income people in the United States.
Right. Trump's first day in office, he signed an executive order to minimize the unwarranted economic and regulatory burdens of the Affordable Care Act. And so what he did, as you know, at the time, Tom Price, who was the Secretary of Health and Human Services, who was a huge Obamacare critic, he had him heading a department and told them basically, you guys are gonna, instead of taking away healthcare, because obviously that's not gonna pass Congress, I'll do an executive order where the executive branch just has to, they stopped advertising like deadlines for signing up for the Affordable Care Act, because there were still sign-up dates even when he came to office because it hadn't expired. And so they just stopped advertising it. They stopped sending people out into the communities that they were under the Obama administration that were promoting people to sign up for the Affordable Care Act and its programs. So obviously that played, like basically he's doing everything he can without passing legislation through executive orders to get rid of the of Obamacare.
Yeah, Trump was very eager to want to change it all overnight, but I think the Senate was less eager. And like Eli said, they did take away like advertisement and funding to sort of get less people in the know on that. And they also delayed the Cadillac Act. They also took precautions to eliminate some of the policies that included like federal cost sharing, premium subsidies to insurance companies, and they sought to create new like short-term plans. So as much as he could, he's still, obviously as a government, we're still acknowledging like it's against the rules to not sign up for healthcare, but we're not getting people in trouble for it anymore. So as much as you can take your hand off of something, we've done that now. But as far as the complete and full repeal of Obamacare, which was, you know, his aim or like a campaign-driven promise, he was not able to do that.
Yeah, and I think that is partly because they are past the point of no return in repealing it. I think the point of no return was while Obama was still in office and the program was small and no one was on it. But now politically, how do you throw millions of Americans off of a government health insurance and back into the private market to fight it out for their insurance that they just had? You know, politically that won't fly for the Republicans. So I think their biggest failing in this happened before the Trump administration was even in office.
And I think that seems to be, and we're running out of time, so this will be our final question, but that does seem to be the biggest concern or the biggest issue now with discussing healthcare and insurance in America. We're in this in-between phase between a fully public, socialized system, and yet it doesn't seem to be working well for us. So we're faced with a choice. Either we need to go completely backwards and scale down our healthcare system, make it entirely private, perhaps even get rid of elements of the Medicare and Medicaid system. Certainly here in Kentucky, they're talking about making it harder for eligible applicants to get onto Medicaid. Or we need to go the rest of the way. And instead of right now about 54% of all healthcare dollars being the government, we need to go all the way and just let the government completely take control, go to a system like Sweden's or Finland's. So final word for the three of y'all. Which do you think is the better solution? Would we be better off rolling back the clock and going back to something that's more private-based? Or is America at some point going to be forced to just buy into this socialized medicine approach? Marshall, why don't you go ahead and get us started?
Sure. Well, I'd say similar comments on the ACA repeal, that it's too late to go back. We've already hedged our bets, and I challenge you to find a federal candidate for office that won't be outspoken in their support for Medicare and Medicaid, the VA, socialized institutions that we already have in place. So I think slowly but surely moving towards that system is the best for the United States. I think slowly is the key, because jumping right in is not smart. We don't know what we're doing in this country because we've never tried that before. Of course, we can study other systems, but there's no system like the United States. But I think before that could ever happen, it really comes down to the lobbying and the interests in Washington that want the private sector to remain the way that it is.
Oksana, what do you think? All in or all out?
I sort of agree with Marshall in that I think it's too late to be all out. And so if I'm having to choose between all in or all out, I think we have to go all in, but I don't think it happens overnight. And I also don't think there are enough forces to support that for it to happen. I think that we have to, over time, not like over like 100 years, but over time, make small contributions to the end goal. Because people are scared, obviously, maybe not rightly so. Maybe they don't actually have a reason to be scared, but they are scared, and fear is what drives people. And so the more people you have scared, the more interest and the more dollars you have in opposing this. And so I think that clear and concise as you can get, you have to be about what socialized medicine would look like in America. It's like Marshall said, you can study however you want, but America is America. Like we're ourselves. We can't really be compared to anyone else.
America, heck yeah. You get the final word.
So of course, like I'm gonna agree with them, just that we have to, I think we're so far in both with how we run our Veterans Affairs Department and helping people who have served, and the way that we've already passed so much legislation to help people. I think the most hurtful thing would be just to say, okay, government, get your hands out. We're returning to private companies. you who are uninsured, you're going to be uninsured. That's just how it's going to go. So I don't think that would work. I think it has to be like both of them were saying, it has to be a slow process. But I think also what you have to take into account is that if you're going to make it a slow process from the very get-go, you're going to have to, if it's going to be healthcare for everyone, then everyone's going to have to benefit in some way, because it's not going to work if you start off and you're taking from one group and giving to another, but one group is not getting anything from it, because then it will have absolutely no support, and then we'll be stuck in this area that we are now, this gray area where we're not really sure which direction we're going. So I think it's going to be a slow process, just showing people that everybody benefits from this system at some level.
Well, I guess that's where we're going to have to end it tonight. I want to thank my panelists, Marshall, Eli, and Oksana, for joining me on tonight's broadcast. And for those of you who are joining it at home, maybe this is the first time that you've caught one of our podcasts, or maybe it's your fourth one. What I encourage you to do is go and check out our website at CU2018, that's CU2018.weebly.com, where you'll be able to find links to our other discussions on topics ranging from the Syrian war to the education debate. In the meantime, God bless, and thank you for joining us.